Good afternoon, everyone. This is Seth Miller, president of Sanoviv, and we have a really special seminar for you guys today. We're going to talk a little bit about what it is that we do, but I wanted to start off talking about the vision of Sanoviv. I had the opportunity for the first time to come to Sanoviv. I got to know Dr. Wentz about 3 months ago, and I came down with my wife and I wondered, what is this experience going to be like? And we flew into San Diego, and from San Diego, within less than an hour, we were at Sanoviv. And I have to tell you, the second I entered into Sanoviv, it was like I was in an oasis. I could not believe what Sanoviv was. I had heard about it for a couple years prior. I'd heard about what was done at Sanoviv. I'd heard about the grounds. But the thing that I couldn't describe to people was because I hadn't been there, I didn't know what it looked like. I didn't know what the food tasted like. I didn't know how warm and inviting the staff was. I didn't know what an absolutely amazing experience I was going to have. And that there, and with my wife afterward, all we wanted to do was tell people about our experience at Sanoviv. I'm sure many of you have gone through where, you might go to your own doctor or your own psychologist or nutritionist, or, you might go work out with a fitness expert, or, go to your dentist or your chiropractor, or even hit the spa for a massage, etc. But have you ever thought about having that all under one roof and having the opportunity not only to be able to visit the health professionals and medical experts in every one of those categories, but have the opportunity that they are doing diagnostics on you and helping you with the specific possible ailments that you might have or future ailments that might come up, but have them talking about you together every day. That's what happens at Sanoviv, and to me that was the power. When I came here, Dr. Wentz took me in to a meeting room where all of the health and medical professionals were meeting together, and they were talking about the guests at Sanoviv. And, one of the concepts that I learned as a young boy was, that term synergy, where, 1 + 1 mathematically equals 2, but synergistically really equals 4 or 5 or 6, just meaning that the group together is a lot more than the parts divided up. And that was the power for me that put everything together at Sanoviv, is when I saw these professionals working together and doing what they do, but talking about each guest. It had so much power that I knew that we had something special at Sanoviv. It's something that doesn't occur anywhere throughout the world, and you can get that at Sanoviv. I was looking at some different definitions on functional medicine and the model of it, really the key to what we do here at Sanoviv. And I'm sure you've heard of that definition, functional medicine. But I loved, this specific definition that stated, by shifting the traditional disease-centered focus of medical practice to a more patient-centered approach, functional medicine addresses the whole person, not just an isolated set of symptoms. I love that. It went on to say, functional medicine practitioners spend time with patients, listening to their histories, and looking at their interactions among genetic, environmental, and lifestyle factors that can influence long-term health and complex chronic disease. In this way, functional medicine supports the unique expressions of the health and vitality for each individual. The system of medicine practiced by most physicians is oriented toward acute care, the diagnosis and treatment of trauma or illness that is of short duration and in need of urgent care, such as appendicitis or a broken leg. Physicians apply specific prescribed treatments, such as drugs or surgery, that aim to treat immediate problem or symptom. Unfortunately, the acute care approach to medicine lacks the proper methodology and tools for preventing and treating complex chronic disease. In most cases, it does not take into account the unique genetic makeup of each individual or factors, such as environmental exposures to toxins and the aspects of today's lifestyle that have a direct influence on the rise in chronic disease in modern Western society. And so today, we have a really special webinar where we've got several of our health practitioners and medical doctors here with us today that are each going to share a bit of their vision and what it is that they do here. And so I'm really, really excited to be able to get on to that part of the seminar. So I'm going to turn the time over to our medical doctor, Dr. Isaac Mesa.
Thank you, Seth. Thank you. I hope everybody can hear me well. I would like to touch the topic of functional medicine in the practice at Sanoviv. As Seth just mentioned, under this roof we have an amazing crew. We have a destination that under this roof we have the opportunity to talk to the psychologist, the dentist, chiropractor, nutritionist, psychologist, and then we brainstorm ideas. What can we do to help patients turn the corner around and improve their health, prevent any chronic degenerative disease to progress? When I studied medical school, I learned how to turn the alarm off of the burning building. And an example, it's a symptom is just the body's screaming and telling you there is something going on around your energy, vitality, or there is a disbalance in your body function. So a symptom is just the alarm of a burning building, and instead of just turning the alarm off, we should take care of the root of the problem in order to prevent that this continues to progress. And we use a wide range of tools to diagnose our really functional medicine approach. It is a tool to organize medical history, find antecedents and triggers of disease. So I hope everybody's following me in the slides. It's just a great opportunity to prevent what the statistics, worldwide statistics, I cannot believe this. This is just crazy. They already setting our minds that we are going to be part of a world statistics of 2020, and cardiovascular disease, cancer will be the #1 killer in the world, the first cause of death. And I just don't like, I really don't want to be part of the statistics. That's why I put a big topic there. We are not going to be part. People who are listening and people who are doing proactive work on their daily lifestyles, taking supplements and meditation, yoga, we are not going to be part of that statistics. And what we have seen at Sanoviv is that people who take supplements and do all this, really they have a great quality of life. They really prevent the biggest statistics of incidence of diabetes, high blood pressure, obesity, cancer, or stroke or heart attack. So I really invite you all to do proactive in your health and to avoid being part of these statistics. What we have found as an underline is what we call it the secret killer, is chronic inflammation. All the disruptors or the environment and toxicity plays an important role. Combination with a sedentary lifestyle, high caloric diet, or we call it high carb diet, that Karen will speak a lot about that. But I think plays an important role on the cellular level of nutrition and healthy. So if we're putting all the good things to our body, we need to also detox. That's why I put here that it's important to detoxify our body and our cells. So symptoms that I believe that are just signals of the body telling you you need to take care of your health 90% of population is pain. Fatigue is the #1 symptoms. You should go and have your full physical in a place that you can have a very good assessment like Sanoviv, that under one roof you can have a dentist, chiropractor, psychologist, nutritionist, in a great assessment with personalized medicine. I like what Seth said. The future of medicine is just has to be a personalized medicine. We need to fit your needs. We're going to personalize your testing and also the treatments, either through kinesiology or through a specific genetic or epigenetic testing. So I just put overall symptoms that we need to look at and take care of them. Then when we ask questions to our patient, we organize the information. This is a matrix tool that help us organize what was the antecedent that predispose a patient to have a current concern. As you see this slide, you will see that in your left top part of the slide, you will see antecedents that predispose a patient to get a disease. And then we have preconception or prenatal risk factors, and then then you're born, and then there are a couple of things that can happen in your life as a triggers that can activate your epigenetics and turn on those weaknesses in your genes that comes in your family genes, and then have the symptoms. So there are a lot of ways that we can detect all these triggers before the disease comes up, and you have a great quality of life and a great aging. And I believe that it's way cheaper to invest in prevention than taking care of the symptoms. We already saw the healthcare systems are not working because they don't have enough. They don't have budget to take care of the world epidemic of chronic disease. So once we have all this information, once we have the history of the patient organized, then this is a picture of what we do every day. We organize that information, we brainstorm ideas, we have nutrition as a chiropractor. We all have a dialogue, and we organize the plan or the strategy or how we are going to take care of a specific patient. So here's where personalized medicine is at its best. And I don't know, there is no better other hospital in the world that can have functional medicine practicing as we do. So we are certified in functional medicine. I think we practice every day since 13 years, and I believe that we are very confident on what we do. I would like to pass this next presentee with Claudia Schaffino. She's our dentist, and I'm very happy to share the mic to her.
Hello, I'm Claudia Schaffino, and I work as a dentist here on Sanoviv. And well, dentistry here in Sanoviv is very, very different as on a regular dental office, because we usually get patients on the normal dental offices with pain, with discomfort, or when we have the tooth in such bad conditions that we need to extract or that we need to repair the tooth. The type of dentistry that we work here in Sanoviv is a biological dentistry. What is biological dentistry? Well, this is a type of a dentistry where we focus on the overall health of the patient, not only on the mouth, and not only on the tongue or on the tissue that are around it. We check every patient with the symptoms, with the medical symptoms, any psychological symptoms, nutritional symptoms, or chiropractic symptoms. So what we really do is we have our patients to come here. We have their clinical history. We read each person's problem, and then we go to their mouth. We check the teeth. We check the materials that are restored every tooth. Also, we check the gums, we check the bone levels, and also what could be such as hidden infections on the mouth. When we have all this information, we check and we analyze tooth by tooth, and we relate to the other organs of the body. For example, for a person who has cancer or for a person who has an autoimmune disorder, it's very important to see the type of materials that a patient has. When we have metals, when we have amalgams, or when we have root canals, this is a very important impact that this can cause to the body. So we analyze that situation. Also, we relate to certain organs of the body that each tooth corresponds, and we have we design a treatment plan, not only basis on what a tooth needs, is what the patient needs on the overall health. Every day, as Dr. Mesa says, we get to the medical meeting where we share all the information, and sometimes a patient who has a medical problem could start working with the dental aspect at the beginning, and some of the symptoms of the medical problems will diminish or get better after having some dental treatments. So what biological dentistry is a global treatment from the mouth through the overall health. One of the main programs that we have here at Sanoviv is our Amalgam Removal program. This Amalgam Removal program consists on a protocol that we made based on Dr. Hal Hagen's protocol as well as the IAOMT, the International Academy of Oral Medicine and Toxicology. We design a personalized treatment for the patient. We not only remove the metals, or we don't only try to make teeth beautiful or very cosmetic, what we do, but the main reason for removing the amalgams is to remove the toxins, to remove the mercury, and try to detoxify the patient on a big percentage. Our amalgam removal program consists on several treatments, a protocol before, during, and after the mercury filling. Before means having a good health for the patient, having a good environment to remove or to work on the mouth. During the dental treatment means that we need some chelation, we need some supplementation, we need to have a good diet, to have to hydrate the body in order to remove those mercury fillings. During the treatments, we usually we as dentists, the dentist, the assistant, have a very good protection as well as the patient. This is in order to help to don't get intoxicated for the mercury part. After the mercury is taken out, also there are some other therapies that we recommend, such as colonics, lymphatic drainage massages, saunas, and some bioenergetic therapies. These are in order to help to detoxify the body through the liver, through the kidney, and also through the stomach. So also those therapies are very important to take them to do them after the mercury is out. And the main goal for us is to try to encourage each person that has mercury to remove them, or if they don't have them, to try to don't get them on their mouth. So this is a program that it's affordable for most of the patients, and there's a very complete a very complete protocol. This is also being supervised by a physician. So as I told before, this is a very good integrated protocol or program that we have here at Sanoviv. Also, we address infections. We try to don't perform root canals because there are certain controversies about the presence of root canals. That's why I'm going to repeat it again. It's very important to have the story of the patient. When we know that a patient has any cancer problem or any autoimmune disorder, it's also very important to don't have root canals or to try to avoid infections. There are some patients that don't want to do that don't want to lose a tooth, and they prefer to do root canals instead of extractions. With those type of patients, we recommend to do biological root canals. We have also a protocol, and a good protocol that we perform root canals with ozone. We can clean, we can drain, and we can also evaporate some of the bacteria that could be present on the conducts of the tooth with ozone. We have the machine that generates the ozone. We generate ozonated water, olive oil with ozone in order to remove those infections. For those people who don't want to do root canals, there is the other option, that it's the extractions of the tooth. But also with extraction, it's very important to clean the bone that is around it. That's why on most of the cases we recommend to do cavitation surgeries. Only when they are necessary. If we have a big infection, or when we have a necrotic root canal, or when we have a severe pain on certain tooth that doesn't have that we cannot fix, then a cavitation surgery could be the option. Sometimes after traumatic extractions, when we don't have the tooth, we still have pain on the bone, we still have pain on the cheek, and we get confused about that pain. So this is also when we need to look at the X-ray. We need to look at the bone, and then we can find sometimes the hidden infections that could be present as cavitations, and also these cavitations are related to autoimmune disorders. So as one more time, that's why we try to analyze the case study and the health condition of the patient to correlate with the dental problems. Also, another program that we have is the Oral Health Rejuvenation Program. This is also a very good program, because it's very important to maintain the gums on very good conditions, not only for aesthetic, not only for the teeth being white. The main purpose for us on this program is to check the conditions of the gums. There are certain types of gum problem. One is the gingivitis, that is the beginning of the gum problems, which is inflammation of the gums. And we try to avoid having gingivitis and turn to periodontitis. Periodontitis is when the problem gets worse, and this is when we have bone loss on the teeth, and this is when we start losing the teeth, and patient says, well, my tooth fall by itself, and this is a problem that comes from before. This program consists on a lot of education for the guest, to educate and to explain what are the gum problems. When we have inflammation of the gums, when we have bleeding, and when we have soreness of the area, this is when we need to do something. Okay, and also these gum problems could be related to the heart problems, that could be related to the high blood pressure problems, could be related to diabetes, to stomach problems, to ulcers, and also it can be interfering on the treatment of cancer. That's why it's very important that we need to have a very clean environment from the inside of the gums through the outside. This program, we have these two types of programs. When there is the beginning of the problem, that there are 4 sessions. When we clean the teeth, we educate the patients, we rinse the gums with water, with ozone. Sometimes we use some other products with coenzyme Q10 and folic acid. And also we encourage the patient to clean their teeth, to brush their teeth, to floss. And this is a very good program that even after the first session we can see the differences, and even on the 4th sessions, periodontal pockets by 4 millimeters can be eliminated. Then if there are some patients that have periodontal disease, this is a good helper as well, and sometimes we need to combine with a periodontist, and sometimes patients will need surgery, but at least also we are cleaning the gums before, so when we have a surgery, could be the results get better and the bone and the gum could regenerate on a better way. And well, basically what it's more important for us is to integrate everything. It's very important also the problems with the jaw, the TMJ problems. That's why also the chiropractic treatment is very important also with our treatment. That's why on most of the, well, we try to coordinate that with this chiropractic session, or encourage to the persons to continue doing chiropractic treatment after we finish doing, for example, composite restoration or a crown, because sometimes the bite will be shifted. So that's why it's very important to don't fix one tooth or fix 1, 2, 3 teeth. Is very important to fix everything at a time, to have a good gum conditions, to have good restorations, to have a good bite, in order to have a good harmony on our mouth. So that's why the biological dentistry is part of Sanoviv, because we integrate all the specialities on the benefit for the patient. And now I'm going to pass this to Elise Dubois, our greatest chiropractic in Sanoviv.
Thank you, Claudia. So, and just before I start, I have to say that being Canadian, and I've only experienced the Canadian medical system, and I've never been in the States, but just I have to say that for us, the people that will follow the psychology, nutrition, chiropractic, we're already in the alternative side of health. But I was really impressed when I started working here how the dentists and the medical doctors had embraced it and had to unlearn a lot of what they learned in school to be able to let all the information from functional medicine in. So I applaud this, and I'm really delighted to work with people like that are that conscious. So in the part of structural medicine at Sanoviv, we've involved everything that has to do with movement of the body, and basically taking care of the mechanics of the body. It's your machine. It's like the car. No, we're looking at that aspect, that everything works. So it includes chiropractic, it includes the spa, and obviously the fitness department. So in chiropractic, I'll just go over chiropractic a little bit because I think a lot of people have misconception of what chiropractic is. So I'll just cover that a little bit so you can really see how important it is in your process of healing. So in chiropractic, we believe that if we remove the biomechanic interference on your body will have the inability, the innate ability to heal itself. It has like the innate intelligence to go into healing state, because all messages that will control your body, it all comes from your nervous system. It all comes from your brain. So whether it's muscle function, organ function, how you digest, all of this, all the messages will come from your brain, travel through your nervous system, which can be considered like the highway of communication. And this information will reach extremities, organs, and all the cells of your body ultimately will be directed by those messages. So this highway of information travel down your spine before reaching its final destination. So that's why in chiropractic we'll really focus a lot on the spine, but we will work with all articulation, all joints in your body. So we make sure there's no blockages on that highway, and if we do find blockages, we'll do some adjustment and remove them. So it's all mostly manual therapies, and like this we can restore the full communication between your brain and the rest of your body. So really sometimes chiropractic might not be the main thing you're going to do at Sanoviv, but you always get chiropractic treatments because we want to make sure that if there is interference, we remove it and promote the better healing, so that if someone comes for cancer treatment, we'll remove interference on his spine so that his body has the innate ability to fully go into healing and really support all the other therapies that are being done. So the most common misperception of people around chiropractic is that you only go if you have pain. And I'm sure that a lot of you maybe you've done chiropractic often, that's how you've considered it too. If your chiropractor has not educated you more. So there's really a small percentage of your neurons that will relay pain messages. So I cannot tell you exactly which percent because it's far back, but it is around something like 10% of messages are passing on pain information. So really you can have a blockage in your spine, which we call a subluxation, and it's affecting an area, let's say for example the thoracic area, and this has to do with how your liver do detoxification. So you might have you might take supplements, do the right diet, do IVs, but if you still have that interference in your spine, even if you don't have pain, that's something we need to take care of to have full optimal health. So in our team, we use different techniques. I won't go too deep into the explanation, and if you had chiropractors, there's around 50 different techniques, so chances are that nobody works the same way, but what we have here that we can say we're extensively trained is applied kinesiology. Both our chiropractors are trained in that technique, and it is a diagnostic technique. It's kind of like doing functional neurology. So we use muscle testing as a tool to really see what's going on in your body. Really go into it and find the cause of the blockages so we can treat it efficiently. So you don't have the subluxation come again and again and again. So if you look at the cause, for example, through muscle testing, we can evaluate the function, how the meridian system functions, the neurolymphatic reflexes. We can look into your nutritional status, if you have deficiencies, see if there are some emotions that your body has not been able to process. So you can see how integrated this approach is, because then we can relay the information to everybody else in the team that's involved and let the nutritionist deal more with the nutritional deficiencies, let the psychologists go more into the emotional part. So it is a really good experience to work all together as a team. We use network spinal analysis, which is a low-force technique, and it promotes your body to go into a more parasympathetic state, which supports to what the psychology department is doing to promote healing. It's really hard to heal if you're in a fight-or-flight reaction and stressed and running away from the tiger. So that's part of what we do here, and neuroemotional technique and other forms of adjustment that we use at Sanoviv. After gathering all the information, we share it with the team in the meeting. Dr. Isaac has talked about this, and we integrate with them. Like, obviously, we work closely with the MDs when we're dealing with people with chronic pain. I'll talk a little bit about a case, a success case that we've had recently that I thought would be interesting for you because so many people are in pain and have no alternatives. And Claudia already mentioned how we work with dental, so making sure everything is well aligned before you head home after having a lot of dental work. And obviously we work with fitness closely, support them in choosing the right movement depending on our evaluation. The trainers help with rehabilitative type of exercise, making the home programs, so everything with a lot of communication between us. Then our spa. Our spa is very beautiful. Our therapist, oh yeah, I'm not moving forward with my slides. See, that's why we're a team, because now the psychologist is supporting my informatic technical level. Okay, so let me go to the spa here. Okay, so I wanted to talk about the spa because we use the spa not only for pampering you, which we do, but we use it for as a therapeutic function too. So there's different forms of treatment we have in the spa. We go from shiatsu, reflexology, craniosacral, fascia therapy, and lots of different type of body wraps, Vichy showers, the thalassotherapy. So there's a lot of tools that we have in the spa to support you. And we really fully believe in the benefits from body work. So our therapies are always aiming at promoting a different aspect of your health. So whether it's detoxification, like for detoxification, we'll stimulate temperature change in your body. We'll make sure your vascular system is flowing, your lymph system is moving around, and the toxins are coming out. So we're going to look into detoxification. Some therapies will aim more at stimulating, while others will promote a deep state of relaxation, so engaging the parasympathetic system. So with soft touch, you stimulate the release of some specific hormones that will promote healing, promote happiness, and your adaptation capacity. So we will go into more of this if we feel that that's what you need, and some therapies are a more deeper touch, which will help balance the structure, promote better alignment. So really, we try to keep it based on your needs at that moment. And we have a bioenergetic department. In the bioenergetic, for those of you that have come to Sanoviv, we call it the quiet room. But really, it's a beautiful room with the view of the ocean. If you're lucky, you might have seen some dolphins passing in front. Some really lucky people have seen whales. So people get excited just with the dolphins. That's in promoting their healing. So in the bioenergetic department, you'll work to balance the electrical charge of the cell. So you'll work with different devices. Some are diagnostic devices, some are treatment devices. So we always aim at promoting detox, removing, cleaning your electromagnetic field. So for example, for people that are in front of computers all the time, that are close to power line, all those will have an impact on your toxicity level, and we take it into consideration, for example, when we do the matrix. And so a big part of this will be done in the quiet room with bioenergetics. And we definitely work a lot with them to support the structural work for pain management. So I will now pass the microphone to Karen, which is our head of nutrition, and she will give you all the highlights of our nutritional program.
Thanks, Elise. I appreciate that. And this is the second Canadian that you get to listen to. And I have lived in Canada and the United States, and I have experienced both medical in Canada and the United States. And I can tell you that the medicine here at Sanoviv is completely different than anything you've ever experienced in either country. I can tell you that much right now. Well, it's absolutely amazing to have two different schools of thoughts working in harmony here at Sanoviv. You can see in the picture there, that's Oscar Puig. He is a certified nutritionist. He's also a registered dietitian, and he's also certified in functional medicine. And that's me on the other side. My name is Karen Langston. I'm a certified holistic nutritionist, lifestyle educator, lifestyle microscopist, and I'm also the director of nutrition and research here at Sanoviv. When you come to Sanoviv, you will have a nutrition session with either myself or Oscar, and we take the time to learn about you and your daily lifestyle and your eating habits and your patterns. And we then take that information along with your health goals, and we design a successful lifestyle plan for you to implement when you are at home. Nutrition is the wellness of wellness, if you will, and we take nutrition extremely serious here at Sanoviv. We have all organic, we also have locally sourced food, and we actually grow some of our food here on what some of us call a small farm and others call a garden, so you'll definitely have to come down and check that out. We also grow our own sprouts, and we have wheatgrass, and this all helps to building the immune system and is really good for live enzymes. And when you come for our presentations, one of the things that you learn very quickly is that when you take in live foods, you become alive. I'm catching up. My PowerPoint looked a little bit different. Thanks, Jonas. Okay, so the diseases of today can actually be prevented, and some of the diseases that we're seeing today are because of the processed, refined, packaged, and fast foods that we're eating today. And these types of foods increase inflammation in the body. So what we do is that we remove the most common allergen type foods. So we're going to remove wheat and corn, soy, and dairy, which is found in most of the processed and packaged foods. And by doing that, we give your body a rest. Now what we do is we give you foods that are full of nutrients that will help your body to repair itself. See, the diseases of today, such as cardiovascular disease, diabetes, inflammatory bowel disease, and even cancers, are because of an inflammatory process, and they can be prevented by filling your body with the right nutrients. And sometimes these conditions can be reversed. And when you are in the allopathic world, most of the diseases are dealt with a Band-Aid approach. You go and see the doctors, and what do? They just give you medications. They're only dealing with the symptoms, whereas we want to get to the foundation or the underlying cause, and part of that is nutrition. One of the big questions is, and I know personally when I came down here the first time as a guest, and I saw all of the salads and the raw food, I thought, oh my Lord, I'm going to starve. You will not starve here. Most people think to be well that you have to eat less food. Well, that is definitely not the case here at Sanoviv. You will eat a ton of food. And what we do is we have you eat the right foods. And those foods are low glycemic and anti-inflammatory. And most of the conventional foods that we're eating today are increasing inflammation in the body, and we know that most of the diseases that are plaguing North America stems from an inflammatory process. So here at Sanoviv, you eat fish and chicken and turkey. You eat tons of raw and cooked vegetables, and believe it or not, we even serve not only rice, we serve tacos. Yes, you heard that right. And you will have to come to Sanoviv and just to taste our tacos. They are absolutely delicious. You will never go hungry here at Sanoviv. We also have conventional and raw food chefs here. We have the most creative and talented chefs that take the art of raw food and make it nutritious, but they also make it delicious. They always work within your health condition. And the food here at Sanoviv is literally world-class and without ever increasing your insulin levels or harming your body cells. And the food not only looks good, I swear from the bottom of my heart, it tastes amazing and it's really, really good for you. You might as well consider it a 5-star resort. And of course, you know the old saying, you can have your cake and eat it too. You can actually do that here at Sanoviv. We have tons of fun here, and we also allow you to have your desserts. Can you imagine actually being able to eat desserts? You're getting better and still being able to have dessert. Now we keep desserts to the weekend, so you definitely have to come down for a week, and you don't want to miss them. And our chefs make the most amazing desserts. For instance, we just had Thanksgiving here a couple of weeks ago, about a week ago or so. And we actually had pumpkin pie, and it was the most delicious pumpkin pie, and everything in it was absolutely nutritious for you. We also, of course, love to celebrate birthdays, and we will give you a low glycemic birthday cake just for you, as well as every other guest that's here at Sanoviv. And of course, all cakes just have the right touch of macadamia and coconut icing. It's absolutely to die for. It's amazing. And you can seriously have your cake and eat it too. We never use flour, ever, ever, ever. You'll just have to come to Sanoviv to see how delicious and nutritious our desserts are. And the best part is you're eating something sinfully delicious, and yet it's good for you. I hope I've got my point across about, you know, the total food here at Sanoviv. So we have different diet philosophies to meet each individual's needs. We have a diet specific for those who want to do a deep cellular cleanse or a light detoxification. And we have a special menu for cancer or diabetes, inflammatory bowel disease, irritable bowel syndrome, as well as those who just want to come and relax. We take extra care and attention to allergies as well as your dislikes, and you will never ever find on the premises of Sanoviv gluten, soy, or dairy in any of our foods. You're only going to find healthy, organic food affairs. Now, Dr. Mesa talked a little bit about diet and disease, And what he's saying is basically that most of our diseases today are stemming from what I call the SAD diet. That's the standard American diet. Most diseases today are an inflammatory process. And so we remove the foods that cause the inflammation that are full of nutrients. And nutrients decrease disease. So when you're suffering with a certain condition, disease, or cancer, you don't have a deficiency of a medication. What you have is a nutrient deficiency that is not allowing your body functions to run properly. So our goal is to work with the doctors here at Sanoviv, look at what they find through all of the medical testing that they do here, and then of course they're going to find those imbalances, and then they're going to put the proper, we are going to put the proper nutrients in place to make your body work optimally. So eating the right foods and living a healthy lifestyle allows for prevention of illness. So you definitely have to come down to Sanoviv for the experience. You have to come down for the taste of Sanoviv. And you know what? I know that I'll be waiting to see you, and I know that everybody else is waiting to see you here at Sanoviv. Thanks so much. And now I pass it on over to Jonas.
Hi everyone, thanks for joining us. And I wish you could be in this room. You know, it's difficult sometimes to get a group of health professionals together and have them genuinely like each other. And we do, very much so. You can hear the laughter. I didn't cue that. That's Karen actually laughing here. I hope you can hear that. So I think that really, the energy of that really shines through here at Sanoviv, and it really has an effect on what you can achieve by working with this wonderful team that, again, we work together, we like working together, we complement each other, we've known each other for a long time or a short time, but we're just really, really a cohesive team. So I'm going to talk a little bit about why it's important to take into consideration all the aspects of psychology and spirituality in your healing. First and foremost, it's very important to notice relaxation and stress in healing. Basically, relaxation is tied to your healing response. The more you relax, the easier it is for your body to go into its natural healing state. That is sometimes referred to as the parasympathetic nervous system. Elise was mentioning a little bit about that just a few minutes ago. So the more you connect with that, the more your body is in its healing space. And all the therapies, nutrients, supplements that you're taking, your body is just much more open to receive them and make the best use of them. So usually here at Sanoviv, your morning will start by practicing several different types of relaxation practices, things that you will find, and you will find in these practices at least one thing that really suits you, that you can keep doing back at home, so you can really bring the peace of Sanoviv home with you. And this is very, very important. Why? Because we know through research that stress can block healing responses in the body. It's very well known that even though your body might have everything it needs to heal, it will not go into that response, it will not go into that state if stress is present, because your body it feels like it's in danger. So when in danger, it goes into its survival mode. And it's just focused on one of two things, running away or fighting something off. And that is a very ancient, very important response. And we need to find ways on how to balance that. Because before, long, long time ago, that was actually a great response to face the dangers we had. And I mean this like several thousands of years ago. Because if we got stressed, it meant a couple of things. We were either starving because we couldn't find food, something was attacking us, so then we needed to get ready to fight or flee. But now, in our modern day societies, that's not really the case. Most of our stress comes from being stuck in traffic, being late for a meeting, having relationship issues with our spouse, family, etc., etc., these types of things. But our body still responds in the exact same way. So it's very, very important that we manage our stress. So here at Sanoviv, we use many tools to support your ability to connect with relaxation and manage stress. So the more you're able to do that, the more you're able to find that balance within, the more likely everything that you're doing for your health and healing, for fixing your physical body, will have the desired effect. So let's talk a little bit about what are some of these things that we do to promote lifestyle changes to improve your health. So some of the tools we use here to promote these lifestyle changes are done in individual counseling. So we do some of the most basic generic type of therapy, which is cognitive behavioral therapy, what you will find in any other place. This is just very standard type of psychology that we practice. Another type of psychology that we practice is called energy psychology, which is using the ancient wisdom of the energy meridians and the chakras to have or to create a balance in your emotional, mental, and even the spiritual aspect of your well-being. This has been widely used now for several years in the United States, Canada, and in Europe, in some areas of Europe, with amazing results. So we're very big on that because of not only the results, but also because usually those results can be achieved in a few sessions. So it's actually quite quick, usually. Something else that we practice is family constellations, which is another amazing therapy that helps us recognize our place within our family system. And sometimes we have found that people can be experiencing different types of symptoms and different types of issues because they are not in that place where they need to be. And something within themselves and that family system is just not flowing. So these are just a few things that we do here at Sanoviv. So what I really want to share with you is we have so many different types of tools that it's very, very likely that we will have a tool that will serve you in what you're looking for, especially in balancing the emotional, mental, and spiritual aspect of your health. We also have some group sessions working within a group to help balance all these aspects that can really lead to chronic health issues. We also have psychoeducation presentations, classes on how to learn, learning how to bring balance into these different areas like stress management, purpose in life. We also have a class on humor and how that is very healing for us. All these aspects of things that are very important. And we have classes in the morning and the afternoons of meditation, yoga, and energy medicine. And all of these, again, are meant to help you find that balance within, find that aspect of yourself that really needs to just come to a more peaceful place so then your body can more effectively heal. And so now, Elise, we're going to be talking a little bit about the success case. Please listen attentively because this is really interesting.
Okay, so we decided to talk about a success case we had with a 56-year-old female with chronic pain, because a lot of us have chronic pain, and that's something that often is not well addressed in the medical field in general. You just take medication and that's it. So we thought that this was a good example of how integrative we can be here at Sanoviv. So those are the diagnostic you can see on the screen that she came here with. She was suffering from fibromyalgia. She had mild depression, chronic sinusitis, hormonal imbalance. She had hypothyroidism and a lot of food and environmental allergies. And those food and environmental allergies would actually trigger the pain too. And she had chronic constipation since she was a child. She was depending on laxatives since she was a child. And when she came at Sanoviv, she was on all of those medications. So basically, I'm not going to read through them, but basically she was taking around 12 tablets a day for pain management. And even like that, taking 12 tablets, she was still in acute pain. So, and that's not even talking about the amount of supplements she was coming with, because this patient actually happened to be very educated in the health field. She was a health practitioner herself, so she was really already having a good lifestyle. She was not the type of patient that come and ate McDonald's right before coming to Sanoviv. So she was already gluten-free, dairy-free diet. She had the right supplements she was taking. So this is even more challenging because sometimes when a patient comes, it's easy to see, okay, the diet is all wrong, let's change that, and work on those things. And for her, it was not an obvious cause. So we started looking into her case. Her main objective was to live a painless life and to reduce the amount of pain medication that she was on. That was why she came. She wanted to be off, at least reduce. She didn't think she could be off of it, but reduce them. A lot of those pain medication are addictive. You become, well, not addictive in the way that you crave it, but actually you become dependent. So it's really hard to remove patient from those kind of pain medication. You cannot go cold turkey. So after the team gathered all the information, what we saw through the functional medicine matrix is that she previously had a history of many traumas through accidents. She had some surgeries. She had high level of lead that showed up in the test that we did. She had low level of vitamin D, which promotes inflammation too. And an important antecedent for her is that she had been adopted. And that was triggering a lot of stress in her life, even though she was working in psychology and she was herself in that field. So after talking with the team, we decided to focus on the detoxification area. So through this, we did many IVs, we did some spa therapies that were specific for that, colonics, bioenergetics. So that was to promote the detox part. And we decided that this area, structure, and emotional work were the three areas that really had to be focused on. That was our priorities. So after the doctor exposed that to her, we started working. And so she was here for a month. And so she's had the chance during her stay at Sanoviv. At the end of her stay, she was only taking 1 tablet of the pain medication. So she went from 12 to 1 because you can imagine that getting off of those medication is not something you can do within a week. So by guiding her and accompanying her through her stay, we were able to bring her and reach her goal, which was to diminish it. I don't even think she had thought she would feel that good at the end. So even with just 1 pain medication, she had just 1 area of her body that was still a bit unstable. But she did a lot of emotional work, obviously, in the psychology department. She worked a lot with what Jonas has just exposed, like energy psychology. Family constellation was a big one for her because of the adoption. And through the work that she did, she actually decided to go look for her biological parents and decided that through the help of the doctor and the psychology, decided that this was a really healing thing for her to do. And now doing follow-up with her the 14th of November, which was 3 weeks ago, almost a month ago, yeah. Through our follow-up, we've learned that she's been able to maintain her improvements, and she's very grateful. She's been reacting really well, and often when she was under stress or doing some diet indiscretions, like she went on a trip she was on a trip for a month actually on a cruise, and she was really worried because of the food they served there, and that would trigger all her pain. So even because of the healing she had had here at Sanoviv, she was able to maintain the good response from her body. And I have to say that that patient had gone to other centers, and she had done IVs, she had done everything already. So I'm pretty excited of how she reacted. And our last follow-up email, she wrote to us that life is much, much better. I'm looking forward to my next visit to continue the progress. So we wanted to share that example of a case with you so that if you have people that you know, if you experience pain or any other type of dysfunction in your life, just really keep us in mind and recommend us to people around you. It could be the best gift you could do to them. So I will transfer you back to Isaac, and for just...
Thank you, Elise. That was a wonderful story, and like that story, we have several ones. Stage 4 cancer with great quality of life in the 3-week intensive medical program. as well in other programs. And just I want to touch base on because medicine should be personalized. We also have programs personalized that fit for you. I think with the leadership of Seth Miller and with the collaboration of the whole staff, we have created great plans for short days or for more intensive, which I think Seth will speak about. But my last input will be when you come to Sanoviv and either you do a integrative physical program for 3 days or 2 weeks or 3 weeks, or you stay longer, it doesn't end when you leave Sanoviv. You're attached to us in a leash. It's very difficult to get rid of us. So we have a great follow-up program where we stay in contact, and I just want to share this beautiful paint that a patient of Sanoviv sent us after reading, after having a follow-up conversation all the way across seats in Europe. She sent us that, which is a great example of how beautiful follow-up it is. They don't feel alone. They don't feel left out. I mean, we are in contact. We do the first contact the first week that they leave, and then we make sure that supplements and the treatments and make sure that they stay on course. I think that's the most important. And I believe this is our priority. And also, we like them to come back for a health checkup, just to make sure that everything is okay. So I will pass now to Seth Miller. If you have any questions, please feel free to ask him when we finish.
Thank you, Dr. Mesa. I'm excited to be back with you today. I've been thinking of quite a few different exciting elements of what we're doing here at Sanoviv. And about 20 years ago, I chose to go into international business as my career. And, currently serving as the president of Sanoviv here in Mexico, flows right along with what I've been doing my whole entire career. I've had the opportunity to travel to 60 different countries, to live in 8 different countries. And people have asked me, why did you do that? I have a lot of friends that have never left their city and have traveled minimally throughout their lives. And my response to why I decided to choose this as a career more than anything else was after I had taken a couple of trips earlier in my life, I fell in love with the strengths and the differences in cultures around the world. And I've had the opportunity to touch nearly every continent and had the great opportunity to learn to speak Spanish and a little Portuguese and a little German. But my true love for international business, more than anything else, is the relationships with people that are very different from me, because I've learned that there is great strength in their differences. And, the word I've often used to describe this is harmony. I personally would much rather listen to singers harmonize rather than just sing by themselves. And so that's truly been my love, is to be able to take my strengths and passions and work among other people that are also passionate about what they do, but are also super talented. And as you see today, as a bit of a sample from our healthcare professionals, that not only are they very talented, but they're very diverse. We have people from Canada, from the United States, from Mexico, and I'm sure there's other countries here as a part of our staff. We have 130 team members here at Sanoviv to really serve you. And as I think about that and that opportunity, I think about the peace that I feel every time I come in to Sanoviv and I look at the ocean, and there is something so peaceful about this part of the world that we're in. And then to not only get fed these nutritional meals that we've talked about, but there is a hint of a Mexican menu. If you like Mexican food, there's slightly, it's interesting with such a nutritional flair. The thing I love about it is how I feel. I eat nearly every meal while I'm at Sanoviv here, and I can't describe how much better I feel when I eat here than when I'm eating other places. But it's true. And the question that resonates with me, and that I often think about is the what if. My wife had the opportunity to go through and do an integrative physical here at Sanoviv, and she's still in her 30s, and I know that she's questioning what could be wrong with me. Her mother has gone through 3 bouts of cancer. And when that happens, you think, is it in my genes? But there's something that we know about epigenetics and nutrigenomics that says differently. There are studies that have been done on twins, on identical twins that have had very different lifestyles and have eaten very differently. And the way that their genetics have turned out doesn't change, but what is called the epigenome has changed. And so the way these identical twins die and the age that they die at is different. And I found that absolutely phenomenal to see that not only the way that we eat, but our environment, our spiritual nutrition, the exercise that we do, that affects us. And so the question that was going through my wife's mind, as she thought, again, about what her mother has had to go through was, well, I have to face that. Well, we know now from science that we can do something about that. But do you know today where you are at? Do you know medically your situation? Probably not. You're probably just like my wife, wondering, where am I health-wise? I've tried to eat good, but I haven't always done it. I've tried to exercise, but I haven't always done it. I've lived all over the world, and I've lived in some pretty contaminated cities with a lot of smog and pollution. So, where am I headed? Well, how do you know that unless you go through and do a series of diagnostics? That's one of the great things that at Sanoviv we offer, is a set of diagnostics, because more than wanting to treat and heal chronic and degenerative diseases, we want to help you prevent them. And the way to do that is to come to Sanoviv and to go through an integrative physical and to see where you're at, to allow us to do those diagnostics and clinical tests to be able to help educate you. And if treatments are needed, to do that. But to find out where you're at is so critical. I've asked some of our medical doctors here, about patients that come in, our guests that come in with stage 4 cancer. And I've asked them, what if they would have come in much earlier on, when they had stage 2 or even stage 3? Or what if they would have come in before they even had cancer? Because that's what we do. We help you know where you're at so that you start making the right lifestyle choices to help prevent that from occurring in your life. And that's the beauty of what we do. On the flip side, I also have my father. And he went through a heart attack about, I want to say, 7 years ago or so. And at that time, I was actually living in Germany and had my family over there with me in Germany, but we came home for the holidays every year, and we're actually staying with him. And again, I wonder, what if he would have known about Sanoviv earlier in his life? And what if he would have been able to have had the diagnostics done on him? Because as you know, heart disease and a heart attack, sometimes there's nothing you can do about that. And it's too late. And so I plead with you to come to Sanoviv, to check it out. If nothing more, you know, we are a medical center, but we're also a health resort. If nothing more, just to kind of see what the experience is like, we have a 3-day program that treats you like you're at a 5-star resort with our beautiful facilities. Every room faces the ocean, and there's nothing like looking at that ocean every day. And to be able to start experimenting with these healthy meals, gluten-free, dairy-free, you know, to feel that peace inside, to be able to go through, you know, some of the, you know, the laughter treatment that we talked about today by Jonas is exceptional, you know, to release those natural endorphins and to see that needs to be a part of your life. I don't want you to wonder what if. I don't want you to have to think, wow, my mother, my father, it runs in the family, it's all about the genes. Yes, there's a portion of that, but it's a much lower percentage than people think. The epigenome has a lot more to do now with those studies on what can happen with you, and we want to help you prevent that. So my plea to you today is to come check out Sanoviv. Be a part of it. You've seen that this is a really fun place to be at. You know, when you go to most medical centers, there's nothing fun about it, right? So this is going to be a great experience for you. There's, you know, we have 10 different programs from just a healthy getaway to the diagnostics that I've talked about with an integrative physical to a detox and rejuvenation, all the way up to treating cancer. And so we really cover the full spectrum of preventing and treating chronic and degenerative disease. We do that through diagnostics and education. We've got our treatments and our therapies. We've got the nutritional meals that I've talked about. We have fitness classes for all stages of fitness. You know, we focus on the mind and the spirit, and we have bioenergy medicine. We've got our detoxification, you know, and we've got a world-class spa here, and we all know there's nothing like getting a great massage. We've got that at Sanoviv. So I implore you to come to Sanoviv. You'll never regret that decision, and I'm so happy that you were a part of our webinar today to learn more about Sanoviv and the definition of functional medicine from our experts here. I'd like to open it up now for a question and answer period, and I'm going to turn the microphone over to Jonas to be able to run that session.
Thank you, Seth. We have already a few questions, but in closing, Dr. Isaac commented this very beautiful slide that says, sometimes we think that what we have achieved is just a drop in the ocean, but without it, the ocean will be empty. And, you know, we're very conscious that here at Sanoviv, we really do amazing work. We do it together, and you're our partner. You know, that is essential. So all of us working together will fill that ocean. We'll get all of that, you know, flowing in the best possible way.
That's why wellness starts with a we.
Oh, yeah. He says that. Dr. Isaac says, wellness starts with a we. So, yeah, that's very clever. Never heard that before. So we're ready to take your questions. I can see some questions here. Some about the slides, if we could see them again. You will have this on our YouTube channel by tomorrow, so you'll be able to check all of this information out tomorrow. It will be there, and we'll be happy to share that with you. Will we be offering this webinar again? It's wonderful, and I have more folks that would like to see it. Again, it will be in our YouTube channel for you to share with anyone that would be interested in coming to Sanoviv, that would really love to know about Sanoviv and what we do. Let's see. what is the kind of genetic testing that you do? What company lab? What are the kinds of information that you get back from that test? How long does it take to get these results back? Here, I'm going to pass this question to Dr. Isaac.
Great question. I think that question, it is very important to, it might take me an hour to answer that, but I will make it simple. Epigenetics through Genova Lab, we evaluate the single nucleotide polymorphism, we call it SNPs. SNPs at different levels of detoxification, phase 1, phase 2. We also have the opportunity to evaluate vitamin D receptors, interleukin SNPs, that it's a pro-inflammatory cytokine, that if you do have those epigenetics or those weakness, you can turn on and off that gene and make it worse, or make it you can turn it off and you're not going to be part of the statistics. So I don't know. I think I answered your question. We use Genova Lab for SNPs. If it's needed to do BRCA genes, BRCA receptors for cancer, and other ones, we can also send it to US. But Genova, it's our goal lab.
Okay, a couple of more questions. In addition to the comprehensive general program, are there specific options for ovarian cancer? Oh, okay, another question for Dr. Isaac. So this question again, in addition to the comprehensive general program, are there specific options for ovarian cancer? Of course, and remember, each person is completely unique. Excuse me, Dr. Isaac will speak generally about this, but yeah, each person needs to know kind of what they're dealing with, and we do that through testing here.
The best way that I can help you is that you call Sanoviv. I will, it is great to hear yourself, see you in the Skype, so we can listen to you, read your lab work, evaluate what you have gone through. If you have just been diagnosed or you already have post-chemo, post-surgery, post-treatments, we would like to know it so we can offer a program. In my experience, I've been here 8 years, and I have seen that most of our patients with cancer, they get some benefit of being here. Some for another, you already saw the potential from all my colleagues, and imagine having under one roof everything, and we do have the opportunity to make an impact in your cancer. Ovarian cancer is very tricky. It's very tricky, so we need to find a way to change the environment, change the terrain, help your body to express different proteins that can allow your cancer to change the way it's doing. So I really have the opportunity to say that in the following year, we will have an opportunity to have a great updated. Cancer is changing every day. It's mutating, so we have to keep that pace. And I believe that under this roof next year we will have a great non-chemo herbals or very great potential therapies to target ovarian cancer, breast cancer specifically, and colon cancer. So I hope I answered your questions. The question was if IP integrated physical will be the only program or others. My answer to you will be there is definitely a lot of other programs that you can do. It all depends on your situation. So call Sanoviv and ask for a consultation with your doctor. It's for free, and you will have a lot of options. The next question that I have here, and it's that if we treat stage 4 cancer, the answer is yes, and we are really happy to listen to your situation. We'll pass the mic to Jonas now.
Hi, yeah, so a couple of questions on what the name of our integrative testing on a short visit, that it's called the integrative physical. That's kind of what we've been talking about, of just coming in and oh yeah, and we have another one called Health Check, which is much more basic. And really the invitation is to call us and just answer your questions and just really get what you need from us, because we'll be so happy to just be there with you and help you find the solutions for the health issues that you're dealing with. Another question here, what is the philosophy at Sanoviv about yearly mammograms?
When you ask a question about philosophy of Sanoviv about mammograms, or if you ask a question about any other philosophy, let me just explain you. This is not easy answer because two heads think better than one. And here we are, imagine having Dr. Wentz as a visionary of the founder of Sanoviv, giving his life to create cellular nutrition and antioxidant and keep the cell alive, and asking the question about mammograms and radiation destroying your cells. I really would like to tell you that everyone that is under this roof, we really do an echo on finding other imaging tests and avoid mammogram as much as possible, any radiation or x-rays. From the medical perspective point of view, I was trained to recommend mammograms a yearly basis. But as 8 years ago when I started working here, I have found the opportunity to see other imaging tests like MRI, thermography, or ultrasound that is non-invasive, is non-toxic, and it will give us great ideas. So the answer in that question, I will say that mammograms can be substituted with other imaging tests that can allow us to prevent breast disease, like thermography. And I think if my mom asked me that question, I will send her immediately to do thermography, ultrasound, or MRI if it's needed. Yeah, thermography, the question that I have here, I hope I answered the previous question. Now the next question is, do I need a yearly thermography? I did one last year at Sanoviv. So I highly recommend to do a follow-up with your doctor. I don't know the result of your thermography. It all depends on the physiological response of your body to that challenge. So we did a challenge test with cold water, and that your body needs to respond to that. And depends on that result of that test, your doctor can tell you when or how often you need it. I recommend that if you have a thermography that show mid or high risk, to do it in 6 months after you did treatment, because when we have an abnormal thermography, that means that there is something going on with your physiology, in your hormones, as well with your liver, as well with your sympathetic and parasympathetic nervous system. So if there is something going on, we give you treatment, and then we have to repeat it again to find out if really we did an impact in your body. So I think I hope I answered your question. Thermography is non-toxic, so you can do it as much as you can, but really it's important to follow through.
Well, folks, thank you so much for your time. We are out of time, but if you have any more questions, please feel free to check out our YouTube channel. We'll have this lecture there, and any other questions you might have, you can just write them down there. We check this constantly, and we'll be happy to answer any of your questions right there at our YouTube channel. Okay, so thank you so much for joining us. We would love to have you here and just be a part of the amazing work we do here at Sanoviv. So thank you so much. Have a great day. Bye-bye.